Question 53. A patient presents with a gunshot wound that entered laterally to the left nipple and exited below the left scapula. The patient's condition suddenly deteriorates, with a raised JVP, muffled heart sounds, and normal air entry on auscultation. What would be the most suitable immediate management? Option A. Administering a fluid bolus. Option B. Performing pericardiocentesis. Option C. Proceeding with an immediate thoracotomy. The most appropriate management in this situation would be Option B. Pericardiocentesis. The patient's symptoms are indicative of possible cardiac tamponade. Pericardiocentesis can be life-saving in cases of cardiac tamponade. Given the sudden worsening of the patient's condition and the signs suggestive of cardiac tamponade, pericardiocentesis is the most appropriate immediate intervention. Fluid bolus might exacerbate the situation by increasing the pressure within the pericardial sac, worsening the tamponade. Option C might be considered in extreme cases, but the initial step should be pericardiocentesis to rapidly relieve the cardiac tamponade and stabilize the patient. Question 54. A woman who is 10 weeks pregnant is experiencing biliary colic that has been ongoing for the past 5 weeks. What would be the most suitable course of action for management? Option A. Immediate laparoscopic cholecystectomy. Option B. Laparoscopic cholecystectomy after childbirth. Option C. Laparoscopic cholecystectomy during the second trimester. Option D. Laparoscopic cholecystectomy during the third trimester. The most appropriate management option would be laparoscopic cholecystectomy in the second trimester. During pregnancy, the second trimester is generally considered the safest time for non-emergency surgical procedures. Performing the surgery during the second trimester helps minimize the risks associated with anesthesia and surgical stress while also addressing the ongoing symptoms of biliary colic. Question 55. A 45-year-old female who is being treated for hypothyroidism with levothyroxine has a high TSH level. She is scheduled for elective surgery. What is the most suitable course of action for management? Option A. Adjust the levothyroxine dose. Option B. Discontinue levothyroxine prior to the surgery. Option C. Delay the surgery until achieving normal thyroid function. Option D. Proceed with the surgery and initiate thyroxine therapy afterward. The correct option is A. Adjust levothyroxine dose. In the context of elective surgery, optimizing thyroid function is important to minimize the risk of surgical and postoperative complications. A high TSH level suggests that the patient's thyroid hormone replacement might not be sufficient to maintain a euthyroid state. Question 56. A 65-year-old female patient presents with a history of gradual onset solid and liquid dysphagia that has been progressing over 9 months. She also experiences vague epigastric abdominal pain after eating. Her laboratory results are mostly normal, except for mild anemia. Additionally, she reports a sensation in her neck. What is the most probable diagnosis? Option A. Achalasia. Option B. Esophageal web. Option C. Esophageal squamous cell carcinoma. Option D. Peptic ulcer disease. The most likely diagnosis would be esophageal squamous cell carcinoma. The combination of progressive solid and liquid dysphagia, vague epigastric abdominal pain after eating, mild anemia, and a sensation of something in the neck raises suspicion of esophageal squamous cell carcinoma. Dysphagia is a common symptom of esophageal cancer. Achalasia and esophageal web can also cause dysphagia, but the additional symptoms and presentation described here are more characteristic of esophageal carcinoma. Option D is less likely to cause progressive dysphagia and a sensation in the neck. Question 57. During a routine checkup, a mother brings her 9-month-old daughter to the pediatrician. The child's vital signs are within normal limits, and she appears healthy and cooperative. However, a firm mass is palpable in the left flank during the physical examination. There is no family history of malignancy or early childhood death. Urine samples collected from the child reveal elevated dopamine metabolites. Which type of genetic abnormalities is associated with a poor prognosis for this patient? Option A, overexpression. Option B, translocation. Option C, deletion mutation. Option D, imprinting. The most relevant genetic abnormality associated with neuroblastoma and a poor prognosis is option B, translocation. Translocations involving certain genes, such as the MYC oncogene, are frequently observed in high-risk neuroblastoma cases and are associated with an aggressive clinical course and poorer outcomes. These genetic changes contribute to the aggressive nature of the disease and its resistance to standard treatments. Question 58. A patient presents with symptoms of ascites and edema, along with severe muscle wasting and hyperkeratosis. Laboratory results indicate slightly decreased glucose levels and significantly decreased albumin levels. What is the most likely diagnosis? Option A, severe protein deficiency, kwashiorkor. Option B, severe carbohydrate deficiency, marasmus. Option C, rickets. Option D, mild malnutrition. The most likely diagnosis is A, severe protein deficiency, kwashiorkor. Kwashiorkor is a form of severe protein energy malnutrition. Characterized by ascites, edema, muscle wasting, hyperkeratosis, and decreased levels of serum albumin. This condition typically occurs in children and is caused by inadequate protein intake, even when overall caloric intake may not be severely restricted. The presence of edema and ascites, along with low albumin levels, is a key feature of kwashiorkor. Question 59. A patient arrives with symptoms including cough, fever, rhinorrhea, malaise, and conjunctival suffusion. On examination, small, grayish, irregular lesions with an erythematous base are noted on the buccal mucous membrane near the second molar teeth. What is the most probable diagnosis? Option A, measles. Option B, rubella. Option C, parainfluenza. Option D, respiratory syncytial infection. The correct answer is option A, measles. Measles is caused by the measles virus and presents with symptoms such as cough, fever, rhinorrhea, and malaise. The presence of conjunctival suffusion, redness of the eyes, is a classic sign seen in measles. Conjunctival suffusion, buccal mucous membrane lesions, and the pattern of presentation described is not typical of RSV infection, rubella, or parainfluenza.